Hello, everybody, and thanks so much for joining in today for the second episode of Coffee with Chris. Today, I am so excited to sit down with Dr. Victor Grazette. He is currently the Chief Performance Officer at DC Health, where he focuses on driving organizational excellence, fostering a culture of quality, and implementing innovative strategies to improve public health outcomes. His educational journey has been deeply rooted in a passion for healthcare and leadership. He currently holds a doctorate of health sciences, an executive MBA, and has a master's in organizational behavior with a focus on managing change. He's also a respiratory care practitioner, which grounds his leadership in hands-on understanding of clinical care. So today we talked about authenticity in the age of AI. I hope you enjoy this time where I spent with Victor, and please like, follow, and subscribe for future episodes. We have some great speakers coming up, and I'm really looking forward to it. Thank you. Welcome, Victor. Thanks for joining the show today. And I am so glad to have you here to talk about authenticity in healthcare.
It's an absolute pleasure.
Well, thank you. And you know, we've worked together, we've been friends, and you know, I've always valued the open conversations we have. And you know, I think that in this age of AI, you know, people are becoming, in my opinion, further and further apart. And so I really want to know what you've observed as this has occurred, and kind of your strategies for connecting with people. Because whenever I talk to you, you're always very present. And and I think that's a key to maintaining that authenticity. But you know,
Absolutely.
so interested in your take.
Yeah, it's we are definitely in a digital age, and it is not going anywhere. As a matter of fact, it is going to proliferate, and most of our lives will be impacted by some sort of digital entity or process. We have artificial intelligence, we have machine learning. It is not going away. It is our reality. And so I think, at the end of the day, we as I would say human beings, which we are, and I say that because sometimes I think we forget to use this little matter up here. And so we have to maintain what I call authenticity. And authenticity in the human being, in especially in leaders. And when I say leaders, I'm not talking about someone in the executive suite, though that is. But at any given point in time, Chris, either of us is a leader, and it's not a position. It is the way we think and the way we view the world around us, whether it's micro or macro. And so the importance of maintaining presence, which includes your self-awareness, because if you're not self-aware, you can be absent and not know it. And so it includes your self-awareness, also being aware of what I call the space in which you are, meaning the people that are around you, their cues, sometimes their lack of cues. It's a conversation. We can sit in a room and no one can say a word, and there can be a conversation going on. And so that is the awareness. In the age and I will preface this, I am not against technology. Oh my goodness, no, you know me. I love the technology. I love the buttons. I love technology. But I find that there is a danger, an inherent danger in immersing in technology, that sometimes we forget to think. And so we depend upon technology. And that's a whole other conversation, which probably we'll talk about. But maintaining of your authentic self, being present in the moment with the person or persons, with the conversation, and being present in context is important.
Yeah, and that's, you know, I think you've mentioned that before, and I think that you know, the being present part, you know, in an in-person conversation, artificial intelligence and technology, you know, when we sit down and have coffee or whatever it may be, it doesn't really influence us. But when we are I guess, leading from afar. So if we're remote leaders or so forth, or we're conversing with teams, over, using digital tools and whatnot, that's where the authenticity is difficult because there's a big push right now for a lot more automation. And in it, as if I think about physicians in the conversations that are occurring with their burden of receiving so many emails from patients, there's a lot of push for them to generate automated responses, intelligent automated responses, and
Mhm.
if you want to call it thoughtful responses. But you know, I think I can spot when something is written by artificial intelligence. It's getting harder to do, but and I don't feel like people are being authentic when they use those tools, right? So how, as you converse and you're traveling back and forth right now from DC to Colorado and you have to reach out to your team,
Mhm.
do you ever get tempted to use these tools as a shortcut or as to, augment your daily work? Or do you try to stick to what you know about being authentic?
So, authenticity and I do not think they compete, or I should say they should not compete. I think AI is here to complement the human leader, the person. It is here to complement, not to displace. Well, I'll unpack that statement, not to displace, because you will get a myriad of comments just based upon that. AI is not here to replace. And when I say replace, I'm not talking about tasks, because we know the studies have shown AI is great for tasks like compiling data and giving input. AI is excellent for operational efficiencies. AI is really good for massing a lot of data and pulling usable information out of it. So, yes, there is a place for AI, and I think it should continue to be developed.
Mhm.
The danger, or not the danger, but the portion, I would say, of not paying attention. And when you talk about being present, you have to be present even sometimes when you're by yourself. If you are by yourself and you're using tools over and over and over, your presence is, what does that look like? Your presence is ensuring that the tools you are using and the output that you are getting makes sense. Example, I'll give you an example.
Yeah.
In the suite, if you're in the C-suite or you're in a mid-management position and you are getting information to make decisions based upon the output that you're getting, it is always good to remember that output equals what was put in. What was put in, whatever comes out, is non-biased. It has no bias at all, which is good and which can be bad.
Hmm.
So when you're moving widgets, you don't necessarily want bias, right? But when you are using AI output or AI information to make decisions that directly affect people's lives, then, and I'm not saying the decision may be, the output may make a lot of sense from an operational standpoint.
Hmm.
Once the decision is made, the opportunity cost, is it worth just simply following the information, implementing the information, or taking the information and then using your human brain to analyze it? When I say analyze, it makes sense. What I'm seeing makes sense operationally. However, if we were to implement it in the current landscape, will it make sense? What will be the risks? So we still have to take the information, and AI puts out excellent information. Please don't get me wrong.
Yeah.
The information is excellent. It is usually very accurate out of context.
Yeah.
And so once you put it into context, it may not make sense.
Mm.
And that brings us to the authentic leader and AI. So as an authentic leader, and we'll talk about a little more about authenticity, but as an authentic leader, which is really a human-centered leader,
Mm.
you have to be 360 when it comes to making decisions because you are looking at the human side and you are looking at the organizational side, the organizational values, the output, the key performance indicators. So you have to look at 360.
Hmm.
And so the decision must answer both the human question and the operational question.
Yeah.
Because a business company is a company based upon the people that output the work, right?
Hmm.
There are some things that you can do without the human touch. But are you replacing the human? No, I dare to say you are augmenting the human so that they can be more effective when they are people facing, because machines are not people facing. And so as the machines, and I'm using the machines, I'm using the machines very broadly,
Yeah.
you get artificial intelligence as it puts out information. While the information may make sense, does it make sense to Peter, Paul, and Jane?
Hmm.
It may not. If it does, then it's applicable in context. If it does not, then one has to ask themselves, why is it not making sense? Is it
Hmm.
against our current values? Is it against a value or a mission or the vision that we have for the company? And should we follow it? What do we do to our values, our mission, and our vision?
Yeah.
So there's a lot of questions that has to be asked once we decide to use AI.
Hmm. I think so. What you're describing is often considered human in the loop. And then one of my favorite words is augmented or augmentation.
Yeah,
And that's one of the things is that when I've spoken at conferences and so forth, and I get asked every time, will I lose my job? Will I, be replaced? And I
yes,
always want to ensure to people that it's augmenting your current abilities. It's providing creativity and it's providing thought. And
exactly.
having that human in the loop, I think you're bringing some really interesting perspectives and reinforcing what a lot of leaders are saying, which is I use it as a tool to generate creativity, to generate ideas, to change my level of thinking. And then I make the decisions. And then I move forward with discussing strategies and processes and theories with my team. And so it's a really interesting time we're in healthcare because there's and I don't know how this ties into authenticity, but there's a discussion that's saying that the lower skilled or lower knowledge or maybe entry level positions are being the most impacted by the implementation of artificial intelligence, and it's starting to bridge a gap between those individuals and the most senior, the most experienced. So it's a really interesting time where I think that leaders are going to have more tools to empower their growth and to power potential authenticity because they're going to start using different levels of thinking.
Mhm.
Um, and so, but one of the things that I think, again, you are always good at is taking time. And taking time, time is something that we never get back. And that quote, when I heard it years ago, it stuck with me. And so we talk about artificial intelligence potentially giving us more time. And by automating processes, by automating workflows, by doing the things that are task based or, don't really require the human centric, skills per se. So as an executive, this is going to change the conversation just a tiny bit, but if we allow more time for physicians and practitioners and processes, if they become more efficient as an executive, is there going to be a decision at some point where now that efficiency is improved, would you or would you think that there would be more pressure to do more? because somebody can? And I know that's a tough question, but if all of a sudden I have an extra hour or 2 hours or 3 hours a day, would an administrative team potentially look at that and say, well, let's see what else we can add? That's a tough question, I know.
It's not, we we always think that efficiency is the reason to increase the workload in the same amount of time.
Hmm.
And I think I would say the other way. Efficiency is the ability to create more productivity in the same amount of time. Two different things. One may think work and productivity are the same, but it's really not. And in your scenario, physicians at the bedside. So, if you, by the time you finish a history and physical and an assessment, and you do not have to sit down and write this entire note,
Mm-hmm.
it buys you some time. And there are some studies that says and I can't remember the exact number,
Yeah.
for AI will give back to physicians, I think about 15 minutes of time. And I don't quote me, I read it and I don't remember the exact number, but it does give you back time. And what that time is for, it's really to spend time with the patient, because physicians, you rush in and out.
Mhm.
You need to get the information. You need to get the information now because you have to write. And a lot of physicians, and I know I've spoken to a lot of physicians, that they spend sometimes 2, 3 hours after work in the evening
Yeah.
documenting. One has to ask, how accurate is that documentation if it's not in real time, right?
Yeah.
Uh, and and how do you document after work, after the event is over? How accurate is it?
Yeah.
So are you pulling from not artificial, but are you pulling from past knowledge and replicating things that you know should be and not is? That
Yeah.
happens a lot with the human mind. So we see a hypertensive patient, and we have seen so many hypertensive patients that we begin to make a note based upon what we know should be and was not. But
Yeah.
in real time, and I'm not saying that always happens, but it's a question that one raises on the table when you are documenting after the fact, late in the evening.
Yeah.
But when you are in the moment and you have the machine learning, you have something that's actually listening to the conversation and immediately, in not interpreting it, but writing the narrative that's going on, right?
Yep.
Then all you have to do after is go back and look at it and see if it is true. And after all, it may be awkward at first, I'm quite sure, but it would make sense. But it saves you time, because while that is making the notes, you can have that conversation, a deep conversation. You can be present because you know the conversation is being taped. So you can be present with the patient. They can ask you questions and you can spend a little more time being present with the patient. The more present you are, is the more present the other person is. Because I know, so I'll give you an example.
Yeah.
So I went to the ER. I think I had a sinus infection or something like that. But I went to the emergency room, and it really was a hospital I used to work at. And I was an executive,
Yeah.
and I went after hours. So most likely in the night, the people didn't recognize me. Plus, I had on a hat and I was dressed in, really ragged clothes, I would say. So I went into the emergency room. I went through, nobody recognized me. And I know nobody recognized me because I had on the hat, I didn't have on a tie, I had on a leather jacket. It was an old, beat up leather jacket.
Yeah.
And so I sat down in the examination room, and the provider came in. It was a PA, I think, or NNP, I think, an NP. But anyway, the person proceeded to ask me questions. They were very, very, very unessential questions for the reason I came in. Then they decided to assess me, physical assessment.
Hmm.
I didn't take off my jacket. And I'm playing because since I worked there, I wanted to see what happens after hours since I had the opportunity. So I didn't act as though I know what to do. So I sat down there. I came and they listened to my lungs through my leather jacket
Yeah.
with a thick jersey under it.
Yeah.
To my heart, this is all going on, and I am just paying attention and making mental notes, right?
Hmm.
The person was it was very busy. They
Yeah.
were in a hurry. And what the person is actually doing is, if I came in for a sinus infection, they do not expect to find anything else. I look healthy. And so they're going through the check the boxes,
Yeah.
right?
Right.
And then making the notes after the fact. And so what they're using is prior information and assumptive information to put in the note, which doesn't really resemble me, which
Yeah.
when I read, most of it was incorrect.
Yeah.
So and my point is a lot of providers rush because they have to document after. Artificial intelligence is here to help, is an assistance, not to take over. And I don't see if you have an assistant, whether it's a human assistant or a machine assistant, that it jeopardizes you, the person.
Yeah.
So because I have somebody documenting for me, does it mean that I can see two more patients in the same time that I would see one patient is really the question. And I'm not saying it wouldn't happen. I'm quite sure for whatever uh, innovation we have, whatever increases productivity, increases efficiency, someone will find a way to try to push the envelope.
Yeah. I think
And
that's,
that is where that authentic leadership piece comes in. Because authentic, leadership, Chris, emphasizes staying true to one's value
mhm.
and always fostering through transparent communication and I would say ethical actions. And I think there's a book by, gosh, what's the book? The author's name is George, and I think it's in 2003. He wrote something concerning this. But as if I remember I'll tell if I get the name of the
Yeah. Yeah. Yeah.
article you know. So unlike traditional leadership models, that always focus primarily on performance outcomes, authentic leadership prioritizes, I would say, the well-being
Mm.
of, of the human being, I would say.
Yeah.
And so all as we create efficiencies, it is to augment and it is to support and it is to undergird the human being.
So that that's part of the discussions that I've been seeing too is the physicians are jumping for joy, right? I mean, there is an
And they should.
overwhelming because they feel like they're going back to, and this is from leaders everywhere that I see that are both in practice and in artificial intelligence. They're saying they feel so much better about the work they're doing. They're returning to being doctors, not
Yes.
just producers.
Yes.
And they feel like they can connect with patients so much more, which is that connection is
Mhm.
authentic.
Right.
And I think there was a study that I've presented at conferences a couple of times where during a pilot study, at the end of the pilot, 80% of the patients reported they felt like their provider cared more about them because they were able to focus, they were able to pay attention. And meanwhile, in the background, these ambient technologies were recording everything and dropping them into the correct areas and producing the right codes and everything else, which in turn generated actually more revenue for the systems because it's capturing more codes related to diagnostic,
Mhm.
um, you know,
Absolutely.
means.
Yeah.
Um, and so, but so authenticity, if you were to like, if somebody came to you and said, I want to be more authentic in my practice, I have this carrot dangling in front of me because I can use artificial intelligence to really become more efficient in my day. What tips would you give another leader to say, all right, this is what you should be doing with your team? Because that's a tough one, right? It's you have productivity standards you've got to meet, you've got those KPIs. but yet you don't want to disconnect from your team because I think that's going to be a real pressure and it's going to escalate very
Mhm.
quickly in 2025. This year, I think is where the pressures are going to start coming. So, any specific tips or tricks that you can offer? Because I think
Absolutely.
you're going to be in the boat too,
Yeah.
working for the health department. I'm sure that it's going to come in.
Absolutely. And when we use the word authentic leader, and an authentic leader it's really a terminology that really does not define all of what it is. So, and you can have two truly authentic leaders doing completely different things. One, and you can have an authentic leader that can really damage the morale of a team.
Hmm.
And you can have an authentic leader that really improves and manages the morale and increases the morale of a team. Why is that so? Since we love the word authentic leader. But if someone is authentically driven, one, self-driven,
Hmm.
authentic leader, authentically driven to just output. That is who they are. But they
Hmm.
are authentic to themselves, right?
Yeah.
And so when I use the word authentic leader, I'm using it in the sense of what it should be. An
Hmm.
authentic leader is one that values the human being in the context of the organization, I would say, and in the context of the organization and the organizational's mission and values, and of course the output. You cannot sacrifice one for the other. People come first because the output, it's a result of people. KPIs don't, great KPIs don't fall from the sky. Great outcomes do not fall out of the sky and just fall onto a spreadsheet and everybody's happy.
Yeah.
No, it's people doing the work, doing it right, doing it correctly, doing it with passion, doing it because they love the work, and they have support. And when you have a company that have great output, meeting their KPIs or surpassing the KPIs, it is because people are doing that work. And so as a leader, the way I see myself as a leader, as a leader, I see myself as, and I hate this terminology, a servant leader, because it is overused and I think it sounds cheesy many times.
Yeah.
But it means that I am a civil servant to the employees within the organization.
Hmm.
I am there to make sure that to identify barriers to the work, mitigate the barriers to the work, make sure that the employees have what they need to do the work. That's what they come there every single day to do, is to do the work. Every day I come to work, I am there to remove the things out of the way so that they can do the work. My job is to create efficiency so they can perform. My job is to mitigate inefficiencies so that they can perform. My job is to hear what they have to say. My job is to listen for innovation, for listen to different thoughts. My job is to undergird and to serve. And that is, you know me, Chris, so I am not talking. That is who I am. And that's my authentic self.
Yeah. Yeah. And you mentioned serving, and I think that defines a particular characteristic of leadership, a servant leader.
Mhm.
And there's a lot of different kinds, and we won't get all into that. But is being a servant leader, what's the correlation between being a servant leader or different types of leaders and authenticity? And authenticity, I you brought in an interesting point, and one that I'm going to think about for a while, which is
Okay.
that authenticity doesn't necessarily mean good, bad, or indifferent. It just means being authentic to yourself.
Yeah,
Or
exactly.
or you mentioned authentic to the organization too. And I guess I would have to think about that.
Right. So when we're hiring for an authentic leader, that's just really one part because what you're doing, you're trying to hone into who the person is inherently. And so there are two parts to the leader that when I'm hiring a leader that I am looking for. I am really looking for their authentic self. But I'm also looking, can that authentic self merge or be weaved into the values of the organization for the output?
Mm.
If the authenticity of that leader is unable to merge within the culture and the values of the organization, it will not work.
Yeah.
So the authenticity that usually works, it is a person that's authentic. Their authentic self is they're adaptable. And adaptability is great because we all have gaps as leaders, right? There are things I know and there are things I don't know. Some people call them weaknesses, right? I call them gaps.
Opportunities is my favorite word.
Agree. And exactly. And we all have that. If we didn't, we would be perfect and sitting on top of the world. We're not. And so a person that is adaptable is able to, I wouldn't say, but necessarily overcome their weakness or their gap, but they are able to work with people who have the strengths that they don't have and get the work done. They're not so hung up on what they know or what they don't know. The other part of authenticity is an authentic leader is very seldom in love with their brilliance.
Okay.
If you fall in love with your brilliance, you stop learning, or it impedes your learning because you think so much of what you know, right? That it's very hard to see what you don't know. And so I look for someone that is not so in love with their brilliance.
Yeah.
I look for someone, a leader, uh, who is authentically given to change,
Mm.
because today change is inevitable.
It's at a pace too that I don't think we've ever seen it as, I mean, there might be times in human history well beyond my years to experience something what we're going through now, but there is an enormous, I mean, this is a cultural revolution in change. I mean, COVID was,
Oh, wow.
I mean, I won't even go down that road, but
Yeah.
COVID was change definitely like we haven't seen, but now we have AI at a rapid pace where it's not slowing down. And I think adopting to change, that's going to be a good takeaway too, is that authenticity is is one in which you adopt change or accept change or embrace change. I think that's going to be a really good thing to remember. Um,
Mhm.
and that's I didn't think about that. I didn't think about authenticity being related to change.
And the kind of change as a leader, particularly,
Mhm.
is being able to maintain human connection in a digital world.
Mm.
That's a challenge as an authentic leader, being able to maintain human connections in a digital world. So, in the space where I am, a lot of things are done digitally. A lot of things are done not face to face.
Yeah.
And even when you're face to face in the same room, everyone has a device to
Yeah.
do the work.
Yeah.
And because I work in an environment that's highly matrix, uh, policymakers, advocates, politicians, healthcare facilities,
Mhm.
uh, community advocates for health in the produce space. It all seems so disconnected.
Yeah.
And my job in measuring quality and performance, I have to move in and out and among many different disciplines
Yeah.
and maintain Victor.
The
Maintain Victor.
being authentic to yourself.
Exactly, exactly. And so I am people facing all the time, but in a very digital world, because there is certainly not enough time in the day to communicate with all of these people in all of these different spaces and miles apart, right?
Yeah.
And so, data is something that I have to look at a lot.
Hmm.
And then I have to put when I look at data and I analyze it, and some of it I may not understand the why, because it is not, a lot of times it is not what I expected. And so I have to go back to the different administrations and have conversations to understand uh, and not make my position define me as a police, so to speak, right?
Yeah.
Because of we hear the word performance, and I have to remind them it is not an individual performance. I am looking at the organizational performance, but the output, the organizational performance, is you, and me. So all of us, right?
Yeah.
And so I lead. I definitely keep the human connection, and the other challenge is, I would say, ethical in the AI age, maintaining ethical relevance and ethical decision making in this digital space.
Gosh, that's such a big topic too, and I'm glad we have ethicists and so forth to combat that very large discussion or be part of that because it's going to be imperative for the success of AI. And I was just going to say we have just a few minutes left. And what if somebody wanted to explore now, senior leaders, experienced leaders, and so forth, right? Have usually gone around and around with authenticity and have a better grasp. But in just a couple minutes, are there any tools or courses or books or anything for a younger leader and somebody that is saying, well, how do I maintain authenticity? So
Mhm.
is there any guidance that you would offer to them as far as exploring and learning more about how to do that?
Yeah, there are two books. Hold on one second.
Okay.
Uh, in 2003, Authentic Leadership, Rediscovering the Secrets of Creating Lasting Value. And that's by George B., 2003.
Okay.
And then there's another one, 2016, by C. O'Neill, Weapons of Math, not Mass, MATH, Weapons of Math Destructions. And it's how big data can increase inequality and threaten organizational democracy. And that was put up by, I think, Crown Publishing,
Oh,
uh, the group. So I love the weapons of math destruction, especially when in the context of AI, because we're talking about data, right?
yeah.
And as information goes in, if information goes in with a bias, that's exactly what comes out.
Yeah.
But as an authentic leader, everything that comes out, I have to really analyze it. I have to read it in context of where I am and with who I am.
Yeah. Well, I think this is a great start to the conversation. I think this is going to be something that we want to continue talking about this year, especially.
Absolutely.
And if those resources, I definitely am going to drop them into the comment section of the video too, so people can pull those up. And I just really appreciate your time. I appreciate the conversation. And as always, we could have talked all day about this. And
I
so,
know we have sat, many times we have sat in the coffee shop, and it's
yeah,
interesting that coffee with Chris, because we certainly
yeah,
uh, do that and have some great conversation. Chris,
yeah.
you are an excellent voice in this space. I think what you're doing is definitely needed because AI is here to stay.
That was such a great conclusion, and I hope you all enjoyed it. AI is here to stay. Please like, follow, and subscribe for future videos and more wonderful speakers and guests like Victor. Thank you so much. Take care.